President.
The senator from Vermont.
Mike Enzi, the senator from Wyoming, is a friend of mine. He comes from a beautiful rural state, Wyoming. I come from a beautiful rural state, Vermont. But probably that is the end of our commonality. We look at the world very, very differently. And I would hope that in the course of this debate, the American people will see the very profound differences that we have, not only on health care, not only on tax policy, not only on the deficit, but on many, many other important issues. Mr. President, what we are looking at right now is a budget process whose ultimate goal is to remove health insurance from tens of millions of Americans. Now, let us be clear. The United States of America today is the only major country on earth, the only one. I live 50 miles away from the Canadian border. Many of us have visited Europe. We are the only major country on earth that does not guarantee health care to all people as a right, something that I passionately believe in. I believe that health care for all is a human right. I would have hoped that we would be working together to figure out what is a complicated issue as to how we could move forward to guarantee health care to all people in a cost-effective way. But that is not what we are debating today. Let us be very clear. The Republican plan, their budget plan, lays the groundwork for ending the Affordable Care Act, which will remove tens of millions of Americans from the health insurance they get. Now, there is nothing wrong with change. We can always improve. I would hope that during the course of this debate, my Republican friends who want to repeal the Affordable Care Act will come down and tell us what their plan is, how, in fact, they are going to provide quality, cost-effective health care to all Americans. Well, you know what? They all voted against the Affordable Care Act. Senator Enzi is right. We did not get one Republican to vote for it. They have had 8 years to be thinking about how they're going to come up with a new plan. And I would hope, but I do not expect, one Republican to come to the floor and say, oh, yeah, we're going to throw 20, 30 million people out of their health insurance. This is our new plan. This is how we're going to provide health care to those people. They have no ideas. Their theme is to repeal and then delay, or someday they're going to come up with a new plan. You don't destroy a house without having another house in which people to live. You don't throw 30 million people off of health care without having a plan to provide health care to those people. Number two, under the Republican proposal, something that many Republicans have been talking about for years, they want to end Medicare as it presently exists, a program which is life and death for millions of seniors. And they want to voucherize Medicare, give people a check, and then let them go out to the private insurance market and get the best deal they can. Imagine that you are an 85-year-old senior citizen who has been diagnosed with cancer, and you get your check for whatever it may be. We don't know what it will be, $7,000, $8,000, $9,000. And you go to the insurance company, you say, I've got $9,000, I'm 85, I've been diagnosed with cancer, I want you to take care of me. Give me an insurance program which will take care of my medical needs, my hospital needs, and the insurance agent will laugh in your face because $9,000 or $8,000 will last you at most for a 1 week. That is their plan. Right now, and I've been all over the country, the American people are outraged at the high cost of prescription drugs in this country. Let us be clear, because of the power of the pharmaceutical industry and their lobbying and their campaign contributions, a power that exists, by the way, not only influencing Republicans, but too many Democrats as well. We pay the highest prices in the world for prescription drugs. In fact, 1 out of 6 Americans who go to a doctor to get a prescription for an illness can't even afford to fill the prescription. And yet, under the Republican proposal, if you eliminate the Affordable Care Act, the donut hole, which now helps seniors pay for their prescription drugs, will be eliminated, and prescription drugs for seniors could rise by as much as 50%. Oh, and by the way, at a time when we have more income and wealth inequality than any other major country on earth, when the very, very rich are getting richer while the middle class shrinks, the Republican proposal not only throws 20 to 30 million people off of health insurance, not only raises the price of prescription drugs for seniors, not only moves forward to privatize Medicare, but shock of all shocks, our Republican colleagues want to give massive tax breaks to the top 2%. Now, among many, many other negative impacts that the repeal of the Affordable Care Act will have, will be one that it will impact heavily rural states like Wyoming, Vermont, and other rural states around this country. And that is, as a result of the repeal of the Affordable Care Act, rural hospitals could be forced to close their doors, not getting the funding that they need, leaving millions of Americans with nowhere to turn for critical medical care. So I look forward to this debate. Nobody here thinks that the Affordable Care Act is perfect. Nobody believes that at all. The goal is how we repair it, how we improve it, how we expand health care to more Americans, how we end what has been the case for decades in this country, that we pay by far the highest prices in the world per capita for health care. And maybe we should understand that we are the only major country in the world that allows private insurance companies to profit off of people's illness. Mr. President, the proposal being brought forth by the Republicans is not only poorly thought out, it really is not popular. It is not what the American people want. You go back to your hometowns and ask people that when a time when the top 1/10 of 1% owns almost as much wealth as the bottom 90%, when the top 1% is earning 52% of all new income, you go out and you ask your constituents whether we should give huge tax breaks to the top 2%, and they don't think that that is a good idea. According to a poll released this month by Politico and Morning Consult, 80% of the American people think the federal government should be spending more money on Medicare. Only 10% think we should be spending less. 71% of the American people think we should be spending more on Medicaid. 84% of the American people think the federal government should be spending more on Social Security. In other words, the proposal that we are seeing from the Republicans today is way, way out of touch from where the American people are. And there's another issue out there that I find extremely interesting. Senator Enzi mentioned, and of course he's right, that within a couple of weeks we are going to have a new president. Donald Trump will be inaugurated as president. And I think it is interesting that we listen to what Donald Trump said during the campaign. The Democrats hear what he had to say during the campaign, what he campaigned on, and more importantly, Republicans listen and hear what their leader had to say about these issues. And this is what Donald Trump said, and he didn't say it once in the middle of the night. He didn't say it in an interview. This was a central part of his campaign. This is what he asked millions of elderly people and working class people to vote for him on. These are the principles that Donald Trump ran and won the presidency on. On May 7th, 2015, Donald Trump tweeted, quote, "I was the first and only potential GOP candidate to state there will be no cuts to Social Security, Medicare, and Medicaid." End of quote. On April 8th, 2015, Mr. Trump said, and I quote, "Every Republican wants to do a big number on Social Security." That's not Bernie Sanders talking. That is Donald Trump talking. "They want to do it on Medicare. They want to do it on Medicaid, and we can't do it. It's not fair to the people that have been paying in for years." End of quote. Not Bernie Sanders, Donald Trump, our soon-to-be president. On March 29th, 2016, Mr. Trump said, and I quote, "You know, Paul Ryan is the Republican Speaker of the House, you know, Paul wants to knock out Social Security, knock it down, way down. He wants to knock Medicare way down, and frankly, you're going to lose the election if you're going to do that. I am not going to cut it, and I'm not going to raise ages, and I'm not going to do all of the things they want to do. But they want to really cut it, and they want to cut it very substantially, the Republicans, and I'm going to do that." End of quote. What Mr. Trump said was exactly right. Here are the day. This is the day. They want to cut Social Security. They want to cut Medicare. They want to cut Medicaid. Mr. Trump was right, and millions of people voted for him on the belief that he would keep his word. Well, it seems to me that Mr. Trump right now has got to do one of two things. Number one, if all that he was talking about was campaign rhetoric, then what he was obliged to do now is to tell the American people, I was lying. Yeah, I said that I would not support cuts to Social Security, Medicare, and Medicaid, but I was lying. It was a campaign ruse. I just said what came to my mind to get votes. I had no intention of keeping my word. And if that's what he believes, if that's what the case was, let him come forward and say that. But if that is not what the case is, if he was sincere, then I would hope that tomorrow or maybe today he could send out a tweet and tell his Republican colleagues to stop wasting their time and all of our time. And for Mr. Trump to tell the American people that he will veto any proposal that cuts Medicare, that cuts Medicaid, and that cuts Social Security. And what we are talking about right now, let us be clear, no debate, that is exactly what this goal is. That's what this budget proposal is. It is to move toward the voucherization and the privatization of Medicare, to make massive cuts in Medicaid, throw millions of people off of health insurance. So there's a lot of responsibility on Mr. Trump's shoulders. But I would hope that he could save us a whole lot of time by telling the American people that he was sincere in what he said during the campaign, that he was not lying. And if that is the case, we can end this discussion and get into the serious business of how we create a quality health care system, guaranteeing health care to all people in a cost-effective way. With that, Mr. President, I would, what do we yield the floor? I would yield the floor.
Mr. President. Senator from Vermont.
I ask unanimous consent that Jenna Sablin and Natalie Rico, detailees to the Budget Committee, be granted floor privileges during the consideration of SCON Resolution 3.
Without objection.
Mr. President, Ron, can I just...
The Senator from Vermont.
Mr. President, I ask unanimous consent that Mike Jones and Josh Smith from my staff be given all-access floor passes for the Senate floor during consideration of the budget resolution SCON Res 3.
Without objection.
Yield for a moment.
I would be happy to.
And I want to thank my colleague for, I thought, a very thoughtful presentation of talking about the implications of simply repealing Obamacare. The assumption that many of my colleagues seem to start from is that before Obamacare, the health care system was great in America. Everybody had health care in a cost-effective way, and then Obamacare came along and all of these problems arose. And what the senator from Michigan just told us, and I want people to remember it, 8 years ago, you had cancer. You were diagnosed with cancer. You walk into an insurance company and they say, why would we give you insurance? We'll lose money on you. Your cancer may recur. You're a woman and you want maternity coverage? What do you think is going on? Why should we do that? You're a family that has a kid who's 21 years of age and you want insurance for that kid on your policy? Well, you couldn't have it. So I think what the senator from Michigan pointed out is not that anyone thinks that the Affordable Care Act is perfect. Nobody thinks it doesn't need improvement. But to simply throw out all of the benefits, throw 30 million people off of health insurance. During the budget hearings a couple of years ago with Senator Enzi chaired, I asked the question of my colleagues when this idea came up, and I would ask it again to my good friend from Wyoming. What are the studies that you have seen in terms of the number of people who will die when they lose their health insurance? How many thousands of people will die because they no longer have health insurance and they cannot go to the doctor in the hospital? And the studies that I have seen suggest that many thousands of people will die. And that's kind of common sense. If you throw 30 million people off of health insurance, they're going to die. So how do you go forward providing a death penalty to thousands of people without having any solution to it? And further, I would add to the excellent points made by the senator from Michigan. Senator Enzi and the senator from Texas before him talked about the impact of health care problems on rural areas. I come from a rural area. Michigan has large parts of the state being rural. The senators from rural areas on the Republican side have said that they want to make sure that their constituents in rural areas can see a doctor. That is certainly a modest proposal. Of course they should be able to see a doctor. If that's the case, my Republican friends should understand what the Federation of American Hospitals and American Hospital Association have said about repealing the Affordable Care Act. These are major hospital organizations. And according to a very recent report, what they said, the Hospital Association said, repeal of the Affordable Care Act will mean a reduction in payments to rural hospitals of over $165 billion over a 10-year period. According to the hospital associations, rural hospitals will suffer an additional loss of $289 billion from their inflation updates. And they said, and in their report, I quote, this is a report from the Federation of American Hospitals and the American Hospital Association, major healthcare institutions in America. They said in their report, and I quote, this reversal of health coverage would represent an unprecedented public health crisis, end of quote. And furthermore, they said, and I quote, the magnitude of reductions would threaten hospitals' ability to serve patients, end of quote. So when we talk about the needs of rural Americans, I would hope you listen to what the Federation of American Hospitals and the American Hospital Association has to say. Okay, with that, I yield.